Well, the science in the last 10 years has had more advancement in understanding that it's a disease than any time before that.
Just like diabetes is a disease of the pancreas, where your pancreas doesn't secrete the right amount of insulin, mental illness and addiction are diseases of the brain, where the chemicals in your brain aren't working correctly.
It shuts down the frontal cortex, and that's why people who are heavily addicted are not making very good choices, because the thing that allows us to reason and all of that is right here in the front.
The disease only means to kill you, but before it does that, it wants you miserable. It wants your family and friends miserable, and whatever circle, whatever you do, it wants to destroy. And that's its only purpose.
Among the general public, the disease concept has really not been bought.
We've sort of stigmatized it because we didn't understand the science, I think, for so long, and we've actually led people to believe that it's their fault. Very rarely do we tell people it's their fault for having other diseases, that there's something morally wrong with them. These kinds of issues are that it's a choice.
Why don't you just quit? Look at all you have to lose. You know, that's not dealing with it on a disease basis. That's dealing with it on a more moral or judgmental basis.
And so until we break through some of that stigma, we won't have the number of people asking for services who need it.
I don't know of any neighborhood in America anymore that doesn't have drugs or its problems with drugs in the neighborhoods, so it's everywhere.
Alcohol has always been a problem, and it's always the major problem.
Meth is not the #1 drug that is facing Oklahoma. Alcohol is still the #1 drug, the #1 reason and cause of addiction in our state, and a lot of times that's missed. Fastly growing behind meth, getting very close to the meth rates, as we've discussed already, is the rate of prescription drug use and abuse in our state.
My experience is opiates, prescription drugs, are the main problem.
And the largest increases in the opiate class of drugs. These painkiller issues that we're seeing headlines on are real.
So we're talking Loratab, Oxycontin, kind of a synthetic morphine situation.
There is a perception, both in adults and kids, that think, hey, this is safer. This isn't the same thing as using marijuana or using methamphetamine or heroin. This is safer. It's medicine. But what we know is the effects are just as devastating.
Readily available, fairly cheap, very hard detox. Opiates store themselves in the fatty tissues of the body, and when you are detoxing from that, the release of those opiates into the system make a person very uncomfortable.
It is the most painful physically and emotionally to detox from. And when you have a drug that is that hard to detox, that the withdrawals, you wish you were dead, that keeps the use going.
If we don't provide treatment when someone needs it and asks for it, they could then end up in the criminal justice system, which will cost us more as taxpayers than if we had simply provided the treatment in the first place.
These are life-threatening diseases. There are overdoses. There are suicides in our state. These are harsh realities of what I believe is a underfunding and underprioritizing of the need for the services we provide.
Unfortunately, where we are statewide in our state money, there's not probably going to be a budget available to build new inpatient facilities anytime soon. And so what do we do when we can't get them the level of care that they need to follow through?
We spend 3 and 4 times to incarcerate an individual for 1 year what it would cost to provide addiction treatment services and change the trajectory of an individual's life and produce an outcome that is acceptable to the state.
We already have more people asking than we can help. We already have more people asking than we can help, and we know we still have thousands more Oklahomans who need that help that aren't even asking yet.